Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Andrea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dr. Mikhaila Riska. If her name sounds familiar, Dr. Mikhaila has been a well-known chiropractor in the Appleton area for almost 10 years now, and she's the owner of 920 Wellness Studio. But today, we're excited to introduce you to her new business, Fox Valley Functional Medicine, which just opened in April of 2025. At Fox Valley Functional Medicine, Dr. Mikhaila's goal is to help people get to the root causes of their health issues and not just manage symptoms. Her approach combines the best of functional, integrative, and conventional medicine to create truly personalized care plans that empower people to take charge of their well-being. Dr. Mikhaila is here today to share her insights on what true root cause healing looks like, why so many chronic issues are missed in conventional care, and how functional medicine can unlock the energy, clarity, and resilience we're all meant to have. Get ready, you're going to walk away from these conversations feeling inspired, informed, and ready to take your health into your own hands. Let's get started.
Hey guys, welcome back to the Motherhood Alliance podcast. We're back here with Dr. Mikhaila. Welcome back, Dr. Mikhaila.
Thank you.
We had an awesome episode in the first one where we talked all about functional medicine. We talked about what it is, how you work with patients, and just like the different labs and just an overall view of functional medicine. In this one, we kind of really want to break down what kind of symptoms that people are experiencing that functional medicine can help with. And I know we're going to be talking even more in depth about hormone health and gut health as well in the next 2 episodes. So stay tuned for that. So what are some diagnoses that people may have received from their doctor? Or maybe it's just, what are some common symptoms that people might be going through that functional medicine can help with?
Yeah, and I love that question. And I'm sure as we go along with our journey, we're going to find our niche and probably narrow it down. But it's just crazy to me. We graduated almost 2 weeks ago, and we have 13 patients already, which is just nuts for like it blowing up, and we're very grateful and blessed for that. But it's all over the board. Like my very first patient was a pediatric patient. He's struggling with mouth breathing, so it'd be interesting. Like, why would you go see a functional medicine for mouth breathing? But his background and history was great. I mean, mom and dad eat organic. They've got air purifiers. They've got water filtration. But we're just trying to get to the root cause of what's going on with his mouth breathing, and just giving him different lifestyle recommendations. We're also doing a gut food sensitivity test on him. So just trying to come at it with a different angle than let's just take his adenoids and tonsils out. And
right.
That's not a bad thing, but let's try maybe least invasive first before we have to go down that route. So other things that we can look at, I've got a patient who is and has always been struggling with some hormonal imbalances ever since she was young. She's been on birth control since she was 12. And so for 20 plus years, that really changes, your hormone imbalances and biochemistry. I'm working with a guy that just got done with leukemia. So it's just all over the board, and it's exciting, but also a little like overwhelming because again, it's such a different hat that I'm used to not wearing for the past 9 years and everything too. So we can look at mold testing, we can look at Lyme testing, Hashimoto's. I mean, there's just a whole bunch of different labs that we can run for sure.
What about anxiety and depression? Because I feel like these are all-time highs. So obviously looking at lifestyle factors, we've talked about on many other podcast episodes about how today's age of just being in technology and screens and the comparison world constantly, you'd think that we would not feel lonely, but we do, which leads to anxiety and depression. So what about these mental health aspects? Is that typically stemming from a test you can run, like things like the gut or hormones off or things like that?
Yeah, absolutely. My first thing I would want to look at is like neurotransmitters, like what's going on with your serotonin, your GABA, norepinephrine, epinephrine. What is things that we can really help stimulate those naturally with just lifestyle and relationship changes and such too. But then, there might be necessary supplementation that is needed for sure too. So, and sometimes there is a season to be on antidepressants. I'm not one to say that, that you're too big for that or such, but it's always a goal of ours if you are going to be on that sort of medication, like let's do it for a season and a very needed reason, but also then looking at maybe the minerals that are going to be depleted in your body while you're on an SSRI and everything too. So again, we're not totally against conventional or traditional medicine. There's a time and place absolutely for everybody and a season and a reason for it. But there's different tests absolutely that we can do, and neurotransmitter testing would probably be our first one that we want to look at, as well as you said, the foods that we're eating too. Maybe doing a hormone panel or just looking at a food sensitivity. Maybe you think that you're eating really healthy of spinach and bananas and whatnot, but those are actually inflammatory to you right now. So that might be causing leaky gut, which is then not allowing your gut to produce good neurotransmitters. So it's all connecting these dots and trying to get to the root cause of it instead of maybe just slapping on a Band-Aid at this point.
I do feel like oftentimes when somebody comes in, they just know like, hey, I'm depressed, or hey, I have these kinds of symptoms. And then they might be surprised to know that it's actually because their thyroid is out of whack or because their gut health is just not there. And that's why they're having this very seemingly random, symptom. Mm-hmm. It just seems like all these baseline issues like gut health and thyroid and all those sorts of things are what causes the symptoms that flare up and that we're most concerned with, right? Because we don't see our thyroid. We don't think we're dealing with it, but it's definitely something that's, huge. It's part of it.
Yeah. And to go with thyroid health, I mean, our whole thing is like, how do we just go up the plumbing? That's what we keep talking about, is like, how do we find the actual leak? Because if we just plug the drain and keep adding water to it, that's never going to help like under the sink issue, right? So sometimes we see that with conventional medicine is like, here is a medication just to help improve your thyroid labs or something like that. But that's not getting to the root cause. Maybe it's a sluggish liver, or maybe you aren't processing bile correctly. And that's all an upstream issue that we need to actually go downstream and make sure that we're getting to the root cause of it instead of just solely looking at the thyroid. I think that is such a big difference of functional medicine providers versus traditional healthcare systems, that it's so put in compartmentalized. Is that how you say that word?
Compartmentalized. I can spell it maybe.
Yeah, right. But it's put into compartments.
Yeah.
And that it's like, okay, you go to your thyroid doctor, your endocrine doctor, you go to your gastroenterologist, you go to your OBGYN, like your body is almost put into little pieces instead of just seeing it as a whole system. And it's just amazing to learn of like how your liver really affects your thyroid, and also a difference of looking at optimal lab ranges versus just survival and disease lab ranges. I mean, it's just crazy that you could be on the borderline of disease and severe disease, and a conventional doctor's like, well, it's not in the red, so thumbs up to you and out the door, but that's just so different. And it is such a shift in mindset of optimal and thriving versus hopefully not dying.
Right. Well, and that's why you have so many people with so many different like medications too from all these different doctors, and they're not like checking them. And yeah, I love that functional medicine can just bring it all together.
Mm-hmm. I would be really curious on what percentage of ailments are coming through in the area that's showing the ailment versus comes through in it from a different part of the body. So to kind of explain that a little bit, you were just saying that thyroid, you could be having issues with your thyroid, but it's actually stemming from your liver having problems.
Right.
Right. And so what percentage of even just looking at something maybe a little bit easier to understand for the non-scientific person, if you have knee pain happening, it could be because you have something going on in your foot, and because it's a chain reaction, it's causing pain in the knee.
Right.
So yeah, what a detective type career.
It's fun.
Honestly,
it's so fun.
putting puzzles together and all of that stuff. Staying on the thyroid a little bit, can you just explain, what does the actual thyroid do for our health?
Yeah, it has a lot of different functions. I mean, it can really help with different hormone producing. It gets a lot of its signals from different parts in the brain. So that's another piece that we really looked at, is like, why is the hypothalamus maybe not connecting as well to the thyroid? Why is the pituitary gland maybe not communicating and sending out perfect signals? So it really supports a lot of different metabolic functions in our body, our energy levels. I see a lot of patients with that brain fog or that lower libido. There's so many different functions for the thyroid, so it's really important to get those labs tested, especially for those postpartum, perimenopause, menopause women. That's where we really see a lot of thyroid issues. But again, we really want to support them with going deeper down the stream of finding out what's going on with some of those signals from the brain, the liver, and half the time it's not even a thyroid issue. The thyroid really gets blamed for a lot of things. They're like the scapegoat of the body, but it's like, let's actually look at why they're not maybe getting the signal to not get the support they need, and why they aren't producing the proper T3, T4, TSH, TPO antibodies, those types of things.
Yeah, there you go. That's very interesting.
If someone went to their primary doctor and they tested their thyroid, what labs would they be running for the thyroid versus what you do?
I think they would probably, I mean, it depends on the PCP for sure, but I'm sure they're all going to hopefully do the T3, T4, TSH, TPO antibodies. Those are the general ones. But sometimes they don't even do that. Sometimes they just do like a reverse T3 or the conversion right before that. And you really want to see why those lab values are appropriate. And again, what they're looking at might not be as optimal range as what we're getting to. We kind of touched on that of disease state versus optimal and thriving. I also like to look at like doing an iodine test and maybe selenium as well. Those are really good, important minerals that we can all be supporting our thyroid. So like eat your Brazil nuts. Those are really good for selenium and such too. But again, I think there's so much focus on the thyroid as a scapegoat. So like, let's almost look at different body systems that send those signals to it, and they're just like kind of shooting the messenger at this point.
Mm-hmm. Now, switching gears a little bit, but I think it's still similarly related, Hashimoto's. This is an autoimmune disease that a lot of people have heard about, but don't know much about it. But I feel like it's almost, I don't want to say commonly diagnosed, but kind of commonly diagnosed. And if I know correctly, it's actually an autoimmune disease that attacks the thyroid. Is that right? And tell us a little bit more about Hashimoto's.
Yeah, for sure. And I would echo kind of what I've stated before too, of like, why is your body attacking itself? That's with any autoimmune disorder. And even in functional medicine, we almost don't go down into each diagnosis for Hashimoto's or for, how do I say this correctly? Like, we don't go for the diagnosis. We go more for that broad spectrum of autoimmune, because if you've got Hashis, you probably have got a different autoimmune disorder. Like, why is your cells attacking each other? And why is this probably more of a system-wide thing? So that's where we are differentiating ourselves from the conventional med doctors comparatively to us, that you might be diagnosed with Hashis, but let's look at a system-wide issue of getting those foundational pieces back in order so we can get Hashimoto's or autoimmune disorders back on track. So it's more supporting the body as a whole system. But yeah, Hashis can definitely be presented with that low libido, or looking at poor metabolic rate, and how do we support that patient who isn't feeling their best. I find also just visual representations, and I sound so nerdy when I say this, but now like I look at people's eyebrows and I look at their nails, and it's just like, I feel like I'm like judgy person out in the community, but I'm not judging. It's just so interesting.
We know that is like, as personal trainers, we're always looking at like how the posture is, and like, all that stuff. So
and you don't want to be creepy, but it's like, you're missing the lateral third of your eyebrow. Like, you should come see me for thyroid health. Like, what's going on here?
That would
how
get
creepy
attention.
Is that?
So for things like thyroid disorders, whether it's stemming from the thyroid or stemming from somewhere else, or Hashimoto's, once you're able to get these labs back and kind of see what's going on in somebody's body, just to give somebody a little bit of picture of hope here, how long does it typically take someone to start feeling better when they are working through and they've actually found what the problem is and now they're working through a path to healing?
I would say hopefully within like 120 days, because your blood cycle is going to go through that, and that really affects a lot of things too, your red blood cells, but also just making sure that patients are doing their homework at home too. So I'm hoping within 12 weeks or 120 days is kind of what we say. Again, that's a blanket answer. If you're struggling with breast cancer versus maybe SIBO or something like that, it really just depends on the diagnosis, but we can definitely see significant changes within 90 to 120 days, depending on, if patients are compliant at home for sure too.
That's huge. That's a big part of it for sure.
And I feel like those numbers, when someone sits down and thinks about, okay, 3 to 4 months, that's not that long.
Mm-mm.
Yeah.
And your journey could be longer, but it's not like you're talking 3 years before you could feel a difference.
Right. For sure.
Like that renews a lot of hope.
Well, and I also think that the things that you have to do now to fix the issues you're having doesn't have to be forever. Like the supplements, maybe you do have to take quite a few supplements for, a couple months, but that doesn't mean it's forever.
Right.
So,
right.
I mean,
Absolutely.
it is a short time, but for long-term gain.
Another one that a lot of people struggle with is allergies.
Yeah.
Seasonal allergies, but then there's food allergies. There's different types here. Can functional medicine help with allergies?
Yeah, absolutely. For food allergies and intolerances, I think we come from a different place and understanding as well, because you go to certain different clinics and they might give you a laundry list of like, you can't eat this anymore. You're allergic to kale and spinach and, even healthy things. But there's definitely different grades of sensitivities and intolerances for sure. So that's something to take a peek at, because some kids truly can't have nuts. I understand that 100%. But at the same token, we come from a different place that we are going to eliminate certain allergens in your body of why are you reacting to those certain foods. We're going to run that finger prick panel and just see what's going on for the sensitivity. We're going to remove it, but then we want to heal your gut to later introduce it. So we've got a full protocol that unless it is a true food intolerance that you're having this really bad reactive hives going to the ER situation, like if it's a lower grade sensitivity and your body really could be benefiting from some of these healthier foods, it doesn't have to be as restrictive as some people think. And again, you go to some clinics that maybe have a different mentality, but if we can heal the gut and we can keep the proper nutrients that aren't meant to be leaking out into our bloodstream and everything too, we want to eliminate, restore, and then reintroduce is kind of what we do for our food sensitivity testing.
Yeah, I love that.
When it comes to just like allergies, more of a histamine dominance, there's definitely supportive care that we can do. Like I love Orthomolecular's D-Hist. They have got a really good one for adults and D-Hist juniors. So that's good just during the season, because there are a lot of people that are sensitive to pollen and just outdoor environments. And some of that we truly can't control because our world is just unfortunately filled with pesticides and Roundup and just spraying chemicals. And we can do the best that we can do to control. But when it comes to environmental stuff, I mean, I really encourage patients to get like an air purifier in their home. I really like Air Doctor or Jasper. Those are really good ones to consider in their homes, just to kind of keep that air as pure as we can when you're sleeping, and just breathing all that in and regularly changing those filters for sure. But there's definitely things that we can do of why is that histamine dominance happening in your body.
I appreciate those answers. When it comes to seasonal allergies, it's like, well, if you're allergic to grass, you can't avoid the grass, but there are some things that you can do to actually help with those. So that's encouraging. Before we close out this episode, we definitely want to spend a little bit of time talking about pediatrics, though, because not all functional medicine providers will even touch pediatrics. It can be a whole different ballgame, but this is actually a passion of yours. So tell us a little bit about what functional medicine looks like for kiddos.
Yeah, I think it's just running different labs that your pediatrician probably won't. And again, that's never a shame on them, but their education is just different. And I think it's awesome to see what is maybe a mold panel. Is there is there mold going on in a bathroom at your house or in the walls and such that you need remediation, and that's causing some mouth breathing or some congestion issues in your peanut? But, sometimes you don't get those types of answers going to traditional healthcare. Maybe it is looking at Lyme's, I'm looking at, or Lyme disease, I keep saying that. But it is just looking at, if a kiddo's always hunting and fishing with their dad, maybe they do have a Lyme disease diagnosis, and there's issues that we can help with the little kiddos. Or running like an organic acid test, which is just peeing on a stick, and you can just see what nutrients are being absorbed for those kiddos. And I think you guys would agree to this, but our kiddos are just truly suffering, and there's so much increased diagnosis of chronic disease so much earlier. So let's always get ahead of the ball instead of, again, being that reactive mindset to how do we help these kiddos not suffer from asthma their entire life? How do we help them with ADD, ADHD, those different diagnoses that maybe can be improved by lifestyle changes, supplementation, maybe some testing too that you don't even consider. And, like keep going back to mold. A lot of people do have mold in their house and they don't even realize it. And it can really be causing a lot of brain fog, fatigue, behavior issues. And once that's remediated, then we see a lot of those symptoms clear up, which is awesome.
What's the youngest that you would see?
Oh gosh, my very first patient of a FM patient was 2, so I guess I'm open to seeing anybody. But there's a compliance factor too, and like we just did a food sensitivity test on him, and I chose to do like a finger stick test on him versus like a full phlebotomy draw, because what parent wants to see their kiddo with needles in their arms and such too. So there's things that we try to be very cognizant on. As a mom myself, I would have a hard time doing that for my kiddos. But I'm open to even working with infants and such too, but really working alongside of their pediatrician as much as we can too, or other holistic providers if need be.
Man, functional medicine it's just so exciting. I just love how even when we're talking about specific diagnoses that people may have received from their doctors, like a thyroid disorder or Hashimoto's, you're almost just kind of like, well, do we even need that diagnosis? Let's just look at the whole picture, look at the whole body and see what the body is missing, right? Such a good perspective. This episode was great. And I do appreciate you taking the time to just touch on some of these common things like thyroid and pediatrics and Hashimoto's and allergies, because these are things that people are being commonly told they have issues with or that they're experiencing symptoms toward. Our next 2 episodes, we're going to be diving deep, though, on probably the top 2 reasons people are coming to functional medicine, or at least what they know functional medicine is used for, and that's going to be hormone testing as well as gut testing. So next up is going to be hormone, and you specifically use the Dutch test, so we're excited to dive into that. And then in episode 4, we'll be talking all about the gut and why everybody should care about that. So stay tuned for those episodes. They are the ones coming up next. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.